Welcome to the show. I'm Dr. Page. Today we will be interviewing Shawn Kuhn, who works for a nonprofit pharmacy service called PSI. And he'll be sharing a little bit about some of his experiences with talking and dealing with patients who suffer from chronic diseases, helping us to see people's circumstances through their lenses instead of our own. I'm Dr. Chuck Page, the best guy to see on the worst day of your life, and welcome to the show. I have today with me a friend, a good friend, and his name is Shawn Kuhn. And Shawn carried a lot of hats in his life, and he initially was in the bookstore business and then began to move into more the healthcare industry. And that's what I was going to talk to Shawn about. And he's going to talk a lot about some things that really motivated him to turn into this medicine drug guru. Shawn, how you doing?
I'm doing well. I love the fact that you're the best guy to meet on the worst day of my life, and I will say that when we were, my wife was struggling once with a health issue that. We've been in relationship with you and just talked, and you really were the best person on a day that we were struggling and being able to give us some guidance and
well, thanks.
It's very reassuring.
You're not such a bad guy anyway. I want you to tell our audience about what you do and kind of how you. I know you got into this with your brother, but tell us a little bit about you and what you're doing now.
Well, I work for a specialty pharmacy. Specialty pharmacies are different than your local Walgreens. Mm-hmm. They supply typically infusion or injectable drugs for people with chronic illnesses, and it's just a very unique situation where sometimes they have to take a drug for a year in order to gain their health back, or some it's for a lifetime.
It's quite an expense, isn't it?
It's very expensive. So I have, my two older brothers are hemophiliacs. Those are people who have chronic bleeding issues. The average hemophiliac, I'm 62 years old. By the time they're my age, they have infused 30,000 times in their lifetime.
That's amazing.
I mean, it's just, can you imagine? I mean, I can remember as a kid screaming my head off because I was going to get a shot. And now to be intravenously infusing yourself.
30,000. That's probably more than a dialysis patient. That never really crossed my mind.
Yeah, I mean, it's just amazing. And so hemophilia patients, they have to get what is known as factor, and right. That allows them to clot like a normal person does. Now, you say, well, if they're not getting cut, and it's more than that. I mean, Chuck and I were just at a trade show today, and we were walking probably for nearly 12 hours and on a hard cement floor. Well, that's really hard on your joints. And our joints are pretty normal for old guys. And they hurt a little, but
they don't bleed internally.
Right. And so most hemophilia patients my age, because the treatment has not been as robust as it is now, they're crippled. And
it's amazing.
They've got ankles fused, new knees, new hips, new elbows.
Can't even walk.
Yeah, and some of them were in wheelchairs. And though my two older brothers were hemophiliacs, and I never really, they're mild, so they're only internal bleeders if they have a shock to their system or whatever. I never really processed this. So when I started working for the specialty pharmacy, I started dealing with these people. And one day I met a guy who's in a wheelchair. He's about 45 years old. And his family could not afford the prophylactic or preventable factor And so,
Which is very common
very common.
at the present, because these are pretty expensive
Yes,
medicines.
well,
correct?
the average hemophiliac costs them $450,000 a year to be treated.
Did you say
That's
a $500,000 a year?
Yeah. And so this guy, I met him, he's in one of these electric wheelchairs, and so I was just talking to him, and I said, tell me about your life. And tell me about, what you experience. And he says, I'm in chronic pain. And I don't understand chronic pain. I have to tell you something, Chuck. If I get an abscess in the tooth, I'm paying any amount of money.
Whatever it takes, yeah.
Whatever it takes, rip it out, drug me, do whatever. I'm a baby when it comes to this stuff.
Oh, listen, I run from needles. I mean, I can dish it out, but I can't take it. I can do anything to anybody else, but man, don't come after me with even a needle or all.
No, that's unbelievable.
My palms get sweaty.
So, but he's crippled in this wheelchair. I mean, he can get up and walk, but I mean, he hobbles, and so in order to have a semi-normal life and to be mobile, he's in a wheelchair. And so he started explaining to me. He says, I'm in chronic pain all the time, and so I get to the point that I can't take it anymore, and they check me into the hospital, and then they put me on some kind of a opioid, but they can only do it for so long, and then they send me home with stuff, and then it wears off, and I've used it all that I can, even if I'm judicious with it.
Back in the same place.
And then I'm back in pain, and he said, I lost my business, I lost my wife, and he said, and if that emotional pain isn't enough, then I still have the physical pain that caused all that to happen.
Wow.
And I'm just like, I don't understand this, but yet I'm seeing it, and I said, so what are your options?
How do you cope?
And he said, well, one of my options is I'd be better off dead.
Wow.
And I'm like,
wow.
Well, but you have something to contribute. And he said, but the pain's too much. And so this is where I really learned about chronic pain. He said, sometimes I just wish that somebody would come along and it's graphic, but cave my head in with a baseball bat, dead in my life. Now, I think about that and like, I don't want to have that happen to, let me die in my sleep.
It sounds horrific.
It does.
Yeah.
But for him, his everyday level of pain was so intense that the temporary pain of having his life ended with a baseball bat was almost a sigh of relief, because then his pain would be over. And so I've learned that there are people out there in life that are suffering from pain, that we need to be compassionate about them. I don't think I can take their pain away, but the one thing I'll do say to them is, you know what? People don't understand chronic pain, and I'm sorry that you have to deal with it, and I get it, because I've met other people like you.
What's neat about your story, Shawn, is how you are making a difference on a higher level than, say, for example, a primary caregiver or a nurse. I mean, you're making a difference in the healthcare industry. Just tell us a little bit about this. I know we've talked about this, and some of it goes way over my head, but just tell us a little bit what you're doing and how you serve these people.
Well, in the specialty pharmacy, so I'll give you another group that we take care of. We take care of people with Lyme disease. Again, a
very complicated, very difficult to diagnose.
Misdiagnosed, and you look normal, but you have no energy. You've got joint issues. Not swelling like the hemophilia patient would be, but just joint pain.
Arthralgia is what we would call it.
Yeah, it just, and family members don't believe you that you have this issue.
They think they're crazy.
But they think they're crazy.
Doctors think they're crazy.
Doctors will think they're crazy, and because it doesn't meet a very narrow test, then, well, maybe you do or don't have it. We'll try treating you for this and we'll see what happens. And there again, we have patients who are just, their
Suffering.
lives have changed overnight from being a mom of 3 who's involved in the PTA and thriving in her family to somebody who doesn't get out of bed and who can't cope, and even the brain fog and those things that accompany it. So I think that I don't know that I can do as much for these people as I can say, hey, I'm sorry, and what you experience is real. And if there's something I could share with people today, people who are in pain, we don't see it, but it's real. And I think they just want to know that it's okay that for them to have that pain and to acknowledge it and to be compassionate towards them. You know, you have people that come to you that they have some level of pain, and you can make that pain go away with a surgery.
Well, I can usually make it worse.
Well, make it worse,
but
but at least you give them some good drugs for a while.
One of the challenges now, even with people who have surgery and they need pain medicines, it's very difficult for me to give prescription pain medicines to people because of the new, the new regulations, and some of that's necessary. But it's just amazing, and now there's this assumption that anybody who takes pain medications is a drug seeker.
Yeah.
And, that's kind of where the pendulum has swung in healthcare, and it's not so. I mean, there are people that are truly hurting. And out of compassion, we should be helping, not getting them starting down that road of addiction,
right,
but doing our best to help them in their suffering.
And I think that, those of us who are caregivers or know these people, to just, again, try to understand them and be compassionate. Because it's a burden that I've not had to carry, but I've seen the people who carry it, and I'm like, well, God, please be merciful to these people, and thank you for my health.
Mm. Mm. That's awesome. I feel your compassion as you talk. I think of Jesus and how Book of Hebrews talks about how he can empathize with our frailties, mm-hmm. and how he has been there. And I think about the Apostle Paul talked about those momentary light afflictions are giving us a glory that just is incomprehensible there in Corinthians. And if you're suffering with a difficult problem, with a difficult health problem and chronic pain, hang in there, man. Yeah. You have a special reward. And like Shawn said, I think the take-home message for all of us is just being more compassionate with people. Mm-hmm. And that's awesome. Is there anything else you want to share about your work in the pharmacy industry, or anything you'd like to tell maybe a listener?
It has been a growing experience for me. I've been in business, and there is the business of medicine.
Yes, there is.
But there's also the business of seeing those people who need the business of medicine as people. So I met, through our author circles, I met a woman who had written a devotional for patients with chronic illnesses. And so as I met her and I was talking to her about authory things, like you and I talk about, I also said, boy, your book would be really good for some of our patients. And so I asked her to send us a case of her books, autographed them all, and we just sent them to our patients, because people are more than just a physical body to be treated. They also have a soul, and a soul to be nourished. And even if we cannot, through working with our doctors and working with our pharmacists and stuff, fix that physical body, we can help nourish that soul and improve their quality of life. And so that is something that I'm excited about, and didn't really quite realize that there was a privilege that we had in our specialty pharmacy to help improve the quality of life of people with chronic illnesses.
Man, that's awesome. You know, Shawn, I believe what you do really counts. So often we we think that what we do really doesn't matter, but it really does matter, and it's just great to hear your heart and your concern for these people, and I'm really just proud of what you and your brother Dan are doing, and thanks for being on the show and just talking a little bit about empathy and understanding, something that we all need. So we'll have a link to Shawn and his brother's pharmacy that you can take a look at, and we thank you for your time. Have
Thank
a
you
good
very
day.
much. Bye-bye.